in terms of what things you should do to do it safely, one is you want to make sure that when you start, you would probably not start immediately with penetrative anal sex. You want to sort of work your way up in terms of trying things to make sure you're comfortable. So usually you want to start with some sort of either well lubricated finger or a well lubricated toy, like a butt plug of some kind, and sort of start with smaller objects and work your way up so that you can, one, feel comfortable and be sort of prepared for the eventual penetration. Always want to make sure that you're using lubrication because the anal tissue has no lubrication, not like the vagina where it makes its own lubrication. And so those tissues can get injured very relatively easily. And so you want to make sure that you're well lubricated so that you don't cause injury to those tissues. You also want to sort of go slow and work your way up very slowly. Always sort of communicate, make sure that if there's ever discomfort that you both agree to stop, and make sure you have ground rules very early on in the beginning before you proceed with having any sort of anal penetration. And lastly, and most importantly, use a condom. The reason is that anal sex, while you cannot get pregnant through anal sex, you can still very easily get a sexually transmitted infection. And it's actually more likely in the anus than through vaginal penetration because, as I mentioned, those tissues are super thin and very easy to bleed if you're not being careful. And so that puts you at higher risk if someone is infected to then contract that illness. So always use a condom and be safe.